I am Dr. Jagadeesh, Senior Consultant Physician, KIMS Hospitals, Secunderabad. So this is one of the commonest topic, or a lot of people keep asking me this question. What are the tests what we do for fever? Yeah, fever is very complex thing to discuss. In fact, I can talk the whole day. But as a simpler thing, when we talk about fevers during this monsoon, fevers during this rainy season, as I was enumerating, the commonest fevers we come across is dengue, malaria, chikungunya, typhoid, or other arboviral illness. But if you ask me, should I start evaluating a person who comes? See, there is a person who comes to my OPD and tells he has high-grade fever which suddenly started from yesterday morning. 1 day, 2 days of high-grade fever with headache, my approach will be stepwise. I don't do all the tests on day one. So that is how we can save lot of money and we can avoid lot of unnecessary tests. If you ask me, on the first level, I'll do only complete blood picture. It's called CBP. CBP, based upon CBP, I look at their WBC and platelets, then decide, am I dealing with a viral fever or am I dealing with an infection because of any bacteria? Okay. Now later on, if I am in a place where this viral illness epidemic is going on, I always look at dengue, because dengue slowly within 3 to 4 days there is a drop in the platelet count. So I look at a complete blood picture again to look at this drop in the platelet. If I have to confirm dengue, then I might recommend for dengue NS1 or IgM. Again, depends upon which day of illness, because I see lot of people do every possible test on the first visit, which is absolutely wasting of money. And I don't recommend doing you fever profiles, because fever profile has a lot of fevers included in it. But if you have to understand, your day of illness decides which test we have to do. Rest of the test might be useless if you are doing all together on day one. Please understand, don't waste your money, because your consultations are very cheap, your tests are very costly. It's not just tests and consultations, your treatment is also very cheap. If it is only dengue fever or any other viral fever, I give only paracetamol. The cost of the treatment is way cheaper than the tests what you are unnecessarily spending. So important tests even today will be only complete blood picture. If I have to prove that it is dengue, I do dengue NS1 and IgM. If I have to prove that it is chikungunya, I do chikungunya IgM and chikungunya virus PCR. There are a lot of other tests to look at the other involvement of organs, like I do LFT, I do creatinine, I do rest of the things. But in general, the basic tests what we look for all this viral illness will be only pertaining to that virus. Thank you.